Hi, it's Adam from the Rural Health Workforce Transformation Hub, and I've come out onto the Priory today to give you 3 mistakes the rural healthcare providers usually do in their recruitment and how you can fix it.
Rebuild rural healthcare from the ground up.
Number 1, getting the fundamentals wrong. So look at the biggest hospital in your state, okay, or the biggest hospital in a city nearby, and look at their website. Can you see how it's kind of branded really strongly? And whenever you click on the careers page, which does exist, there's a careers page, you can see other branding information for candidates. It tells them what are the benefits of working there, what's the culture of the organization, what are enrollment opportunities, advancement opportunities, and sometimes it separates that out by jobs. Now look at your website, okay? It might be great, I hope it is, but many rural providers often fall down on this where their website, whenever you click careers, it just has a list of jobs. That isn't enticing or exciting for people living in urban areas to come and work at your organization. You really need to have a strong shop front. You need to show people what your organization does, what does it believe in, what does it stand for. And it doesn't have to be hard these days. There's a lot of tools out there. We use lovable.dev to make web pages. You give it a prompt and it makes a web page in like 1 minute. But again, you can work with your web team to actually build out the careers portion of your website to show people what it's like to work at your organization, what's the experience in the community, and why people should come. You really need to sell the organization on your website. Social media as well. People often look at Facebook pages, Instagram pages before they apply somewhere. Look at your Glassdoor. Look at your Google. Are the reviews good? If not, you need to run a reputation management campaign. You need to reach out to people who work there or have worked with you in the past or had a good experience and say, please give us a review. Not buying good reviews here. We're just saying, here, did you enjoy it? Well, please give us a review. Number 2, they only advertise on job boards. So did you know only about 10% of healthcare professionals are actively seeking a job? The other 90% aren't on job boards. They're not looking for new positions. In fact, they're on other websites. Now, I'm not saying that job boards are bad. Actually, keep your jobs up there. They're really good. But you really want to capture the vision of that 90% as well because, well, they could be convinced. They could be convinced on a lifestyle change, not just a job change, but a lifestyle change. To move from their busy urban environment to a peaceful, beautiful prairie like this one. Don't just focus on active candidates, call them people looking for jobs, but passive candidates too. So how do you do this? Well, as I mentioned before, get active on social media, post stuff, maybe make a careers related page for your organization, just focused on work culture. Do paid ads, so engage your marketing team or the marketing person in your organization to put up posts that you then promote in cities. Be creative. You need to really reach out there and not just do job boards, but look at holistically how can marketing come in to help recruitment or help HR in this drive, because ultimately it's vital for your lifeline of your organization. You need staff. You need to keep replenishing staff. And if you can't do that outside of job boards, well, you're just limiting the number of candidates you're ever going to get. Finally, you have to roll out the red carpet. We see many healthcare providers do an interview, bring people to visit, and they only really get to meet HR and a few of the other staff at the hospital. That's not really enough. You need to give people the celebrity treatment. You need them to understand that if they come to your community, they're going to be a pillar of the community. They're going to change the community for the better. They're going to be such an important person. And that's important because, if you've got 10 nurses in your community, you hire 2 more, you've increased total nurse population by 20%, 20% more care opportunities, potential revenue opportunities for your hospital. They do make a big difference. And we see a lot of organizations just go through the standard old recruiting process for out of area candidates. Don't do that. When they come, introduce them to nurse managers. Yes, but also introduce them to the CEO of the hospital. Is there a lunch that could be put on every week and you bring people in once a week? You say, okay, Wednesday is our visit day. Please come on a Wednesday and you'll be able to meet the CEO, you meet the surgeons, and we'll get people together. Give them a tour of the town. Appoint someone that's focused on community integration. So show them around. Maybe you could even engage the Chamber of Commerce. You could engage the mayor. Really help them see that in this town, they're going to be someone important. They're going to be providing good work to the community, and honestly, that's true. We need to reflect that. We need to show them that whenever they visit or whenever they come for their interviews, they're important. So roll out the red carpet because too many people don't, and it loses them candidates, it loses them hires. In summary, 3 mistakes rural healthcare providers usually make in their recruitment and retention, particularly for out of area candidates. Do not get the fundamentals wrong. Have a strong shop front. Make the recruitment portion of your website updated, interesting, engaging for candidates, so whenever they see it, they think, oh, actually, I hadn't thought of that. I like that place. I'm going to come visit. Number 2, don't just advertise on job boards. You're going to miss 90% of potential candidates. Get out there, get on social media, pay promotions on social media, make people aware of what you do and why people should come to your area. Number 3, and perhaps most importantly, roll out the red carpet. Do not give people the standard recruitment experience whenever they come. Treat them like a celebrity. Show them that if they join this community, they're going to be a pillar of that community, a vital source of healthcare, someone that is important, someone that is helpful. Make them feel like they're special. That's really important. So get them to meet CEO, take them out to lunch, tour them around the town, introduce them to the leaders in the town, and generally just show them that they are going to be a vital part of that community. So there you have it. I hope you implement these, avoid the mistakes, and you'll do a lot better in your recruitment. If you want to learn more about how we can help, at the Rural Health Workforce Transformation Hub, we're giving free strategic grant support and program design for organizations that are going for rural health transformation programs grants. Absolutely free. If you want to execute with us, we can help you with your program implementation. Reach me on LinkedIn, Adam Chambers, or just click somewhere around this YouTube video to learn more. Thank you so much for watching, and all the best with your recruitment.